On average, there are about 160 Christmas decorating related injuries each day during the holiday season, with nearly half of the incidents involving falls. Whether it's toys, cooking, or holiday decorations, injuries can happen during the holidays, and you want to make sure your family is safe this holiday season. Luckily, many of them can be prevented with some planning and a little extra caution. So today we are talking with Dr. Philip Lamptey, Medical Director of Cone Health Virtual and Urgent Care, about how to keep health and safety top of mind. So we're going to go ahead and start here. What's one of the most common injuries you see during this time of year?
I would say that falls is one of the most common injuries that you see most time of this time of the year. And it's said that most of the emergency rooms nationwide and locally see an increase in holiday-related injuries, just like falls and choking and other injuries like burns as well.
And when you say falls, I imagine that can be climbing up the Christmas tree or even, putting up Christmas lights on the house. What are some of those falls stem from?
Yeah, I would say that it starts from setting up the Christmas tree. Typically, if you're setting up the Christmas tree, you should ensure that you are setting it on a stable, flat base so that it doesn't tip over and fall with either yourself trying to decorate the tree or with any kids in the house trying to get to the tree to look at one of the decorations and it tips over and falls with them. Using the right ladder also to set up a Christmas tree helps reduce the incidence of fall for people who are decorating and setting up the tree as well. The other thing is that if you have kids at home, especially younger kids and infants, having a barrier around the Christmas tree will help reduce the incidence of falls or the Christmas tree tipping over and falling on a child in the house.
Okay.
The other thing also would be to clear the pathways of any clutter, extra furniture, and power cords and tucking them away so that people don't trip over them and fall.
And let's talk a little bit more about those holiday directions. They're fun, they're pretty, and like you're saying, they can be very hazardous. So what should people watch out for to avoid the falling and then the electrical issues?
I think for electrical issues, the first thing would be to make sure that you don't overload your electrical outlet with electrical lightning sockets and decorations, because that itself presents a fire hazard, number one. And number two, it also has a risk of falls, because then you'll have a lot of power cords running around the Christmas tree into the sockets, and that makes it more likely for somebody's leg to get caught and end up falling.
This is a time of year where people like to carry around their hot cocoa and then the apple cider and all those things. And so you really want to be careful if you're around those electrical cords, to your point, because, you don't want it to spill.
Mhm.
Okay.
Yes, and also to slip and fall. If you're having a very cozy night with family and you have things spilled on the ground, somebody might not see it and they might slip and fall, resulting in injury and them ending up in the emergency department or the urgent cares to be helped by a health professional.
Let's talk about safety for kids. What should caregivers watch for this time of year when it comes to decorations, small items, food items that really could be choking hazardous?
Yeah, kids under 5-year-old are at risk of choking. And as a rough guide, if you take the tube of toilet paper, if the toy or the decoration that you have, the ornaments that you're putting up can fall through that, it presents a choking hazard for a kid who is 5 years and under. I would say that safety should be at the top of our minds when we are buying decorative items. If we have young children at home, avoiding sharp end decorations that break easily would help. Avoid choking risk and other injuries that they may pose. If you have a tree, you should make sure that if it's a live tree, the trimmings that fall off the tree should also be well disposed of in a way that would prevent a kid from having their hands on those trimmings, because that could also present a choking hazard. And then you think about lighters, candles, and matches. Those things could also be a fire hazard for, um, um, if parents are not vigilant about it, because kids are curious about these things. They may, out of curiosity, use it and injure themselves and cause more injuries for other people as well.
And this is the time of year where a lot of folks are doing a lot of cooking. So what food safety tips should we keep in mind to prevent foodborne illnesses?
Hand hygiene is important in preventing foodborne illnesses. The other thing also is it's the way that we thaw our food itself when before we prep and before we cook them. If you have uncooked meat, poultry, and fish, and you want to thaw it for dinner or lunch, you should make sure that you're thawing it under 40 degrees Fahrenheit, because bacteria grows pretty fast once you go above that temperature. Always use clean surfaces, and also separate uh, cooked food and vegetables and fruits from uncooked meat, poultry and fish, because of cross-contamination of bacteria. Washing your fruits and vegetables also is one of the ways to reduce foodborne illnesses. And then when you're cooking your food, you should make sure that especially with meat and poultry and fish, that the internal temperatures are at the level that is recommended. Meaning that if you have meat, you should make sure the internal temperature is at least 145 Fahrenheit. With poultry, it's about 165 Fahrenheit, and with fish, it's also about 145 Fahrenheit. Leftovers should be stored in the fridge within 2 hours of after everybody is done eating. If this time of the year is cooler, but typically they say that if you are in a temperature of 90 degrees Fahrenheit and above, that time between when you finish eating and you store the food should even be shorter. It should be about 1 hour. And when you take that food out to reheat and eat the leftovers, it should also be warmed up to an appropriate temperature of 165 degrees Fahrenheit.
That's some great advice there. And what about injuries related to candles, fireplaces, and holiday lights? What should folks know?
Well, lights and candles present burning hazard. And I'll say that with the Christmas lights that we put on, if you don't check the cords to make sure that there are no bare wires, or the wires are not frayed, or you don't overload your Christmas tree with lights, those things, if you do, could cause electrical fires. If you have candles, you should make sure that you are putting them out of the reach of children. If it's lit, then you should make sure that you are putting out the candles when you're leaving home, or at night when you're going to bed. The other thing that's also a safety issue is that you should check your smoke alarm, so that in case there is a fire, the smoke alarms would alert um, um, the people in the house, or whoever is in the vicinity, to know that there is fire or smoke in the house, and that would help with identifying that and addressing that issue in a timely way.
And we have about a minute left. Earlier, we were talking about when folks, accidentally fall when they're, climbing up the Christmas tree. When is the best time for them to see a doctor? What would those injuries look like in those next steps?
I would say that if you fall and you have a deformity of any of your extremities as a result of the fall, you need to see a medical person or a provider to assess you and make the recommendations to give you the care that you need. Head injuries with loss of consciousness is one that you should also see a health professional about that. If you are falling from a significant height, that is also one that you need to seek care from a medical professional. And if you have extreme pain, like you cannot bear weight on your legs or use your hands after the fall, that's another sign that you need to see a professional to be evaluated to get a full extent of the injury and make necessary recommendations for care.
We have about 20 seconds. Does that apply for burns as well too, from like a candle and stuff?
Yes, with burns, I would say electrical burns, burns to your face, hands, and feet. And if you have an open wound after the burn episode, is one that you need to see a provider for. If you have the skin that is intact or you form blisters, over-the-counter treatment should suffice. Do not break the blisters. If that happens, see your healthcare provider to give further advice on what to do.
All right. Well, thank you so much, and stay safe out there while you all are out putting your Christmas decorations up.